Hello guys, so right now I am playing Be a Nurse, and I am going to show you the ultimate guide on how to play. Okay, so first we are going to get a patient. I'm in a private server right now because it's definitely very crowded and a lot of people don't know what they're doing in public servers. I feel like a lot of things don't get covered in the tutorial when you first join. So this patient wants to turn off the lights, so I just go near the lights and turn it off. They want the TV off. Okay. Now she wants pain medications. Okay. So the pain medication where you find the medicine, it's by the supply room. And there's also another door to the supply room on the other side, so you just have to pass this room. And then you use this machine. Review, find the name, pain meds. It could be different for everyone, but my patient wants pain meds. So you just give your patient the meds. Sometimes there are requests that you don't need to get stuff and you just press down on the request. Pillows. So the pillows is actually in the linen storage. So we're gonna have to go by where you find the medications, and it is on the right side of the hospital linen storage. We're going to need your key card to open it. And then don't get worried if you get locked out. Anyways, I have a pillow here. Oh, I accidentally got two. I accidentally got the linen, but that's okay. By the way, if you need a blanket, they are in these orange boxes, and if you need to restock them, get the linen. I know it says blanket, but you need linen to use the blanket. I'm not sure why. It doesn't really make sense to me. Sometimes if you leave your patients, something bad could happen to them. My patient just needs an oxygen mask. Sometimes they need antibiotics, or they have a seizure and you need to strap them down and you need to get restraints. Now I draw their blood, so then they get a sample and then I give them medicine. So if you have their sample, you just go to this orange machine next to the medicine machine. Tube system. You send the tubes up. So a lot of the time, whenever I am looking for patients that got left behind, it says awaiting medication, which most of the time people don't know where to bring their test tubes and how to give them the medication, so they leave them. So make sure you are not one of those people because it is very annoying. Okay, I just cleaned everything. Make sure to restock linen. This is the linen. You have to restock it in the linen storage. With this, you just restock it here. If this garbage is full of dirty linens, you go past the linen storage and you go into this dirty utility room, and then you just kind of put it in the linen chute. If you need plaster, you find one of the machines with the plaster. Oh my gosh. For a childbirth, you have to answer the phone in order for the patient to come. Okay. Another mistake that lots of people make, or things that people get confused about, or it might just be me, if you ever get a dirty bedpan and you can't throw it out, then you have to go to a bathroom and you have to dump the bedpan. I found that out myself. I found out all these things by myself, and it was very annoying. So I'm trying to help you guys. If anyone needs restraints, they are in the storage room. Saline, vomit bag, bedpan, puncture tray, catheter. I think that's how you say it. Room 11, they have all of that stuff in this little storage area over here. So if there's ever an emergency, you can just go right here. If I get the stuff on the top, I usually just jump up. There is also a defibrillator over here in case someone is in cardiac arrest. There is also a defibrillator over here, IV pump here, and a plaster station over here. And it's basically mirrored on that side too. If you ever need to check someone's bladder, there is a bladder scanner over here, like the main section. If you need to give someone an EKG, just press down on the request and bring it to one of the people on the computers here. They are the doctors, and you just give them the EKG, and then you just go back to the patient. If you need to check their blood pressure, you get the glucometer here. If anyone needs Jello, you come here to the fridges. If anyone needs water, there are water dispensers basically everywhere. There's a little section where they have water, coffee, and ice. It's by the front desk too. Okay, they need pain meds. So they don't have a machine over here. So I'm just gonna have to walk all the way over here. Okay, now I need to check their bladder. There is a bladder scanner right here. Now we're going to need a catheter, but you cannot take this out of your inventory, so you are going to have to go back and put it back. You need a catheter. You don't have to go all the way to the storage room. You can just get it here. Now, water. Very random request, but you have to stay hydrated. Oh, I just drank it. It's okay. Oh my gosh. Ooh. This is so annoying. Okay, we have water. Now ice. There we go. I can't drink the ice. Now plaster. It's a hip fracture, so we do need plaster because it's for broken bones. Plaster here. Go back. Apply it. Now a bedpan. We already have a bedpan here. You wait. Yes. Send them to CT. They need a pillow. And grab a pillow. Give them a pillow. And send them to the ICU. And then I like to clean this rubbish. Even though it doesn't do anything, it annoys me. Now we have the dirty bedpan. And we go to the toilets. And we dump them. And it completely gets it out of your inventory, which is nice. So that should be everything that you need to know. If I missed anything, let me know. And if you want a tutorial on how to do things in the ICU, I will show you, because I just became an RN and I figured out how to do everything in the ICU. So that's all. Bye.